And we're on location today at Atlantic Gastroenterology, and we've got Dr. Ray Fountain here and Dr. Thomas Sturgis, and these folks are going to tell us a little bit about Atlantic Gastroenterology and what they do as a specialty here. And Dr. Fountain, it's good to see you. It's nice to be in your offices. And for folks who are not exactly sure what Atlantic Gastroenterology is, what is your specialty?
We are gastroenterologists, which means we take care of any kind of digestive disorder, and that can be anything from stomach problems, intestinal problems, colon problems, including liver, gallbladder, anything that deals with digestion.
And Dr. Sturgis, you see patients here every day, but you also have a gastroenterology center right here where you do colonoscopies, endoscopies right here on site.
Yeah, we like to think of us as being a complete package. We not only see patients here for consultation, but we also are able to perform our procedures here on the other side of the building.
And I guess in terms of you hear so much now about colonoscopies, endoscopies. I guess colonoscopies are pretty standard now for anyone who's 50 years old and older. And is it gender specific?
No, it's not. It's same for females and males. And that's just the average age that you start screening, but there are other reasons to do procedures, and so it may be that you're much younger than that and require a colonoscopy for other reasons.
Generally, what are those reasons? Problems that you've had with the stomach problems, other kind of illnesses?
Right. Well, one of the main reasons we see patients is either because they've had some problems with their bowels, or maybe they've seen blood in their stools, or when they've seen their doctor, some blood tests have shown up abnormal, maybe showing some anemia, or even a stool test has shown some trace blood in their stools.
Dr. Sturgis, people who have not had a colonoscopy at 50, or let's say they get into their mid-50s, they're really running some fairly serious risks these days that they need not run, correct?
True. Henry, we used to always recite that about 6% of people are at risk for developing colon cancer, and 90% of those cancers develop over age 50. But now, since the advent of performing screening colonoscopies, nice statistics have come out and showed that incidence has been reduced to about 4%. So we are making a gain. Unfortunately, if you look at statistics, it also tells us probably only about 40 to 50% of most people undergo a screening colonoscopy. So we still have a lot of work to do.
So for someone who's 50 years old, or let's say they're 52, they've never had one, can they just call and make an appointment here?
Absolutely. We take referrals, but patients can call themselves and be able to meet us and schedule a procedure.
And anyone who is in their 50s that has not had one needs to do that, don't they?
Absolutely right.
And how about endoscopies, Dr. Fountain? Do people also need endoscopies as a general rule, or is that something that you only would have done if there's some reason that calls for it?
Usually that's because you're evaluating symptoms. So if you're not having any problems, say with eating, swallowing, abdominal pain, that sort of thing, then you do not need a screening endoscopy.
And Dr. Fountain, I understand you also have a special women's GI center here.
Yes, we've been trying to develop that to really address the needs of women in the community who have GI issues, and they can be anything from irritable bowel syndrome to inflammatory bowel disease. And it's fully staffed by women only, and we cater to their needs specifically. We also have our own infusion center for inflammatory bowel disease patients here in the office, where we can administer Remicade.
You folks, I've known both of you forever, and having gotten to meet your staff today, I think that this is a very unintimidating place. Sometimes when you go to a doctor's office, Dr. Sturgis, it's a little stagnant and intimidating, but this is a very friendly place, and I think people would feel very good about coming here. And I know, again, for folks who are in need of any kind of the kind of work that you do, particularly with colonoscopies, you'd like to have them contact you.
Absolutely. Henry, we feel that the staff, because of what we deal in, and we realize patients can be a little bit apprehensive, but our staff is very welcoming. We're very discreet here, and we do our best to try to make patients comfortable.
Come see these folks at Atlantic Gastroenterology. They're conveniently located just off Arlington Boulevard at 2465 Emerald Place. Or you can telephone for an appointment at 252-758-2424, or visit them online at atlanticgastronc.com, or you can even like them on Facebook at Atlantic Gastroenterology PA.